Okay, so I have an order to give 2 medications through my patient's NG tube. I'm going to double check the order, do my 6 rights for my patient, right drug, right dose, right route, all of that, right amount. I'm going to take my patient off suction and make sure clamp my tubing when I take them off. I'm going to perform a focused GI assessment, listening to their bowel sounds, noting detention, nausea, vomiting, all of that. I'm going to elevate their head to the bed at least 30 degrees. After I give the medication, I'm going to leave it elevated for 30 to 60 minutes to allow the medication to absorb. I'm going to get my meds ready now. I have diluted meds because it's going through the NG tube. And we're going to make sure there's no air bubbles, all that. Get those ready. You'll have to later. Double checking them with the MAR to make sure it's the right amount. Now I'm going to perform hand hygiene. Don my gloves. And I'm going to start by checking the placement of the NG tube. So I'm going to do that with the pH test. I'm going to unclamp my tube. Just take out, just a little bit. We don't need very much. At least 5. No more than 10. Place it on our pH strip. And again, that reading should be under 4. If it's greater than 4, we know it's been pulled on or tugged into a place that it should not be anymore. So now I'm going to get ready to administer my medication. So I have my piston here, and I have our sterile water that goes in between, at the beginning, the end, and in between each med. So to start off, we're going to do 30 to 60 mils just to flush that line, make sure there's nothing blocking it because we want the medication to actually reach the stomach. Then I'm going to give my first med, and in between that, give at least 10 mils of water, and then my second med, and then finish with another 30 to 60 mils of water to flush that line again, and making sure in between each time I don't let the fluid get down too low so air doesn't get into the tubing. So I'll start by unclamping my tube. Attach my piston. We're going to start by filling that piston all the way up and making note of this so I can place it in the I&O report. Let that drain. Slowly getting there. And making sure I'm watching it so when it gets low I can clamp it. Now stop it from draining so we don't get those air bubbles. I'm going to administer my first medication. Let that drain a little bit. And making sure I'm watching. I'm going to clamp it again, add our at least 10 mils of water because we're giving a second med. And let that run again. Alright, and we're going to clamp it again and administer our second medication. And let that run. And then we're going to finish flushing it with another 30 to 60 mils so that we know all that medication makes it into the stomach and help prevent any clogging that could happen. And afterwards, I'm going to document it, make sure I have that all up. I'm going to make sure I monitor my patient to make sure that they don't get any adverse effects from it. Come back, monitor the vitals, the respiratory status, all of that. And I'm not going to hook them back up to suction yet if they're ordered to be on suction. Make sure I leave that head of the bed elevated because we need to make sure that med absorbs fully into the stomach. I'm going to clamp my tube though so nothing comes back up it. And again, keep that head of the bed elevated, document, and make sure I wash my hands afterwards.